Welcome to The Explainer. I am absolutely thrilled you're tuning in today because we are diving into something that affects literally millions of people, yet it's just so frequently misunderstood. Today we're exploring the science of blood pressure, and more specifically, the downright incredible pharmacological arsenal that doctors use to combat it. Now, we often hear about high blood pressure in passing, maybe at a quick doctor's visit or on a morning news segment, but we rarely take the time to truly visualize the brilliant mechanics behind how we actually treat it. So, grab a coffee and get ready, because we are going to break down this complex medical strategy step by step.
Let me kick things off by asking you a question. What if I told you that high blood pressure is not treated with just one type of medicine? We're so incredibly used to the single pill myth, right? Like you have a headache, you take a pain reliever. You get a bacterial infection, you take an antibiotic. Boom, done. But hypertension? Well, it's a whole different ballgame. It's really not about finding one magic bullet. It's actually about assembling an entire team of drugs, a highly specialized crew where every single member works entirely differently to achieve one shared goal.
Section 1. Fixing the water pipe. Okay, let's dive into this. To really wrap our heads around how this medical strategy works, I want you to think a little less about biology for a second and a little more about everyday mechanics. Hypertension, which is just the fancy medical term for high blood pressure, is quite literally like having way too much pressure in a water pipe. Imagine the plumbing right there in your own house. If the water is rushing through those pipes with too much force, day after day after day, it puts an immense amount of stress on the entire system. And over time, that pressure, it causes serious damage. Doctors absolutely know this, so they essentially act like master plumbers. They have to control this highly pressurized plumbing system. But here's the catch. They can't just hit a single master switch. They have to tackle the problem from several different angles to bring that pressure down safely.
Section 2. Diuretics. Draining the fluid.
All right, let's introduce the very first essential crew member in our team assembly, the volume control squad. We call these diuretics. You've probably heard them referred to by their everyday name, water pills. Think about it. If we have a plumbing system with way too much pressure, one of the fastest, most direct ways to fix it is just to decrease the total amount of water flowing through those pipes. And that's exactly what diuretics do. They basically signal your body to flush out extra salt. And, this is the cool part, where salt goes, water naturally follows. By actively removing that extra salt and water from your body, they effectively drain the excess fluid right out of your cardiovascular system. The basic physics here is just beautifully simple. Less fluid inside a closed system naturally means less pressure pushing against those pipe walls. It's an absolutely highly effective first angle of attack.
Section 3. ACE and ARBs. Widening pipes.
But you might be wondering, what if just draining the fluid isn't quite enough? Well, that's exactly when we bring in the crew responsible for pipe relaxation. These specific drugs interact with the actual physical structure of the pipes themselves. We're talking about ACE inhibitors, like enalapril, and ARBs, like losartan. Now, what's really interesting about this is that instead of changing the amount of fluid, these drugs actually change the container. They work by sending very specific relax signals straight to your blood vessels. When the vessels get those signals, they just ease up, they dilate, they widen out. It's like taking a narrow, highly pressurized garden hose and suddenly expanding its diameter. The water inside instantly flows so much more easily, and the pressure just drops. That's the exact mechanical brilliance of ACE inhibitors and ARBs.
Section 4. Blockers. Slowing the pump.
So, let's recap. We've drained the fluid and we've widened the pipes. Now we're going to look at the central power source, the pump itself, and the muscles surrounding those vessels. On one hand, we have calcium channel blockers like amlodipine. These guys are incredibly targeted. They focus specifically on relaxing the tiny vessel muscles, easing the tension right there at the walls. But look over at the other side, beta blockers like metoprolol. These take a totally different, almost opposite route. They go straight to the heart, the literal pump driving your entire system, and simply tell it to slow down. By reducing the heart rate, the pump naturally pushes fluid with less force. And this brilliantly illustrates the two different angles of attack here, relaxing the muscles of the pipes versus physically slowing down the engine that's pushing the water.
Section 5. The specialty squad.
Now, sometimes the standard crew just needs a little backup. While diuretics, ACE inhibitors, ARBs, and the main blockers definitely do a lot of the heavy lifting, the arsenal does not stop there. There are also alpha blockers, central acting drugs, and direct vasodilators. What you really need to know about these wild cards is that they target the body's control center, the nervous system itself, or they act directly on the blood vessels to force a reduction in pressure in entirely unique ways. They basically give doctors alternative, specialized angles of attack when the standard, everyday approaches need some serious reinforcement.
Section 6. Building your custom team.
Okay, let's bring it all home and see how all these moving mechanical parts come together for you, the patient.
So the crucial point is that treating this plumbing problem requires looking at this entire menu of options. We have drugs that remove fluid, drugs that send relaxing signals, drugs that relax muscles, and drugs that slow the heart pump. I mean, it is a truly comprehensive toolkit. A doctor looks at this whole setup not as just a list of independent choices, but really as a roster of potential teammates to draft for your specific health needs.
Because at the end of the day, controlling blood pressure is almost never about finding one magic drug that completely fixes everything all by itself. It's about choosing the exact right combination, the precise wedges of treatment for the right patient. Your specific physiology might require a slice of diuretics paired up with a slice of ACE inhibitors. Meanwhile, someone else entirely might need a combo of beta blockers and calcium channel blockers. The treatment isn't one size fits all, it is a custom-built, precisely calibrated strategy.
When you step back and really look at how these totally different mechanisms, draining fluid, widening pipes, slowing the pump, relaxing muscles, can be combined to perfectly stabilize the human body, well, that's modern pharmacology in action. It is literally a triumph of medical strategy. It takes this dangerous, invisible biological condition and turns it into a totally manageable mechanical puzzle.
Which really leaves us with one final, pretty important thought to ponder today. If you or maybe someone you love is currently managing hypertension, I want you to look past those little orange plastic bottles. Think about the actual mechanics we just explored together. Which squad members are doing the heavy lifting in that prescription? Are they draining the fluid, or are they slowing the pump? Because understanding this, it empowers you to know exactly how your health is being defended every single day. So I'll leave you with this. What does your team look like?